Hi everyone, and welcome back to the journey. As you can see, today we're going to be talking about immune system disorders, in particular systemic lupus erythematosus. I know that's a mouthful, also known as SLE. Now, with SLE, we have a chronic progressive systemic inflammatory response that's happening within the body, and it happens to the major organs in the body and systems, okay? And now, what happens in particular is the connective tissues and fiber deposits collect in the bloodstream and also on the organ itself. And eventually, over time, that those deposits cause necrosis to the tissue. And eventually, once you go through necrosis, eventually the tissue is going to die, and the function of that organ is also going to fail as well. Now, there is no cure for the disease, but there are some periods of remission depending on how well you're able to care for the disease process in itself. But key word is systemic, so I want you guys to know that it's not just one particular organ that's going to shut down. There are multiple organs that it's going to play because it's the whole system. Okay, so these deposits can pretty much be within the blood vessels, the lymph nodes, the GI tract, right, the pleura area. So no matter where in the body, there is no escaping, right? As long as those deposits are able to fall on those organs or within the vessels itself, now there are chances of that necrosis of happening and occurring, all right? So, like I was saying, there is no cure, but the causes, some of the causes is unknown, but they do believe that it is an immunological mechanism that is causing it through genetic origin, all right? There are some precipitating factors that can cause the flares of it to occur, and that is pretty much medication, of course, stress, right? You have your genetic factors, like it's just embedded in you. So sometimes you can be doing everything right, but all of a sudden you just get to a certain age, and all of a sudden you start seeing signs and symptoms and malformation of this disease process. Okay, sunlight and or ultraviolet light, and you also have women of childbearing age. So those women who are expected to be pregnant or can become pregnant, you are at higher risk, okay? And lupus happens 10 times more in women than it does in men, okay? And you also have another type of lupus called discoid lupus erythematosus, also known as DLE. And with this one, it's not as severe as the systemic because, again, systemic is all of the systems, okay? And with some medication, it can be controlled. Sometimes, without it, it just automatically just disappears, okay? So there's still not enough information to exactly go into depth about DLE, but it's less severe than the SLE. And with the DLE, the only manifestation that you see that kind of resembles almost the same as SLE is the skin rash, okay? That's the only manifestation that is seen with. So now we're going to talk about the clinical manifestation, which is also known as our signs and symptoms, which is also known as our nursing assessment. Now, as you can see here, there is going to be a lot of signs and symptoms, just because, remember, systemic lupus is an autoimmune disease, and pretty much with an autoimmune disease, auto means self, so the immune system is fighting itself. For some reason, it's not able to recognize its own body and realize that, hey, we're not the enemy here, but we are part of your body. Somewhere along the line, that immunological mechanism has a defect, and it's carried through genetic, and most of the time it's seen through the autoimmune disease is seen through the collagenous tissue, collagenous tissue, and within those connective tissues and those fibrin, those deposits are then broken off into the bloodstream, which then attaches itself to the organs itself or the blood vessels, okay? So that is what's causing the detection of, there's an enemy in our own body, when really and truly, your own body is your friend, right? It's not your enemy. So if we're talking about systemic, just about every system is you're going to see some type of signs and symptoms depending on what organ it's attacking, okay? So main thing you want to do is assess the precipitating factors, which I said earlier. Remember, those things that are going to trigger it, right? It can be the pregnancy or the childbirth, right? It can be the fact that the sunlight, right? Ultraviolet light, whatever it is that you realize that those factors are triggering the immune response. Okay, so you want to kind of avoid those things, and you want to be aware of those things, so that way you know what to stay away from. All right. Also, you have erythema of the face, which is also known as your mallow rash, which is I put in blue your butterfly rash. Okay, and it's butterfly because it's almost shaped like a butterfly. It stays within the bridge of the nose. All right, and the cheeks. So I put that in blue because a lot of times one of the questions that they like to ask is, the patient comes in with a butterfly rash, what is that a sign of, a symptom of, or what can you concur, what can you expect, or what is indicated, right? It's needed or something like that. So butterfly rash is very important to know. Also, it can cause scarring, right? It can cause scarring because of those rashes, especially if it's itchy, or you rub your face, or if you have sensitive skin, right? Those rashes start to embed, and it also changes the pigmentation. So on a lighter skinned person, that rash is going to be more of a pinkish in color, right? Different from the actual skin itself. So it can definitely change pigmentation. Okay, and like I said before, it's on the bridge of the nose and cheeks, and also you may see it on the palm of the patient's hand. Okay. Also, you have dry, scaly, raised rash on the face. All right. So it's just pretty much another type of rash, but this one is more of a scaly, dry type of rash that you will also see on the upper body. And I put in parentheses the main places that you will see it is the scalp, the face, and the neck. All right. In those areas is where you want to see it most often. All right. As you can see, as I'm going down, I try my best to color code so that way you can kind of see the systems that is a part of. All right, so I put brown for skin. Anything dealing with the skin is going to be in that color. All right. You also have fever, weakness, malaise, and fatigue, which that can be found with almost every disease. So I always say, things that many diseases have in common, try not to remember those as much, because you want to remember the ones that stand out, right? Because those are the ones that you're going to get your questions on. Also, you have anorexia and weight loss, because if you have a poor appetite, you're not going to want to eat, right? So it can definitely cause some GI disturbances, all right? Also, you have your photosensitivity, which is pretty much your sunlight ultraviolet rays that we talked about. And then I put in orange here, that's mostly your musculoskeletal system, where they may complain of joint pain, right? And these are some conditions that they may have. You have your polyarthritis, and pretty much you have joint swelling, and sometimes it gets to the point where it's so swollen that it's so painful to move, all right? So again, that can affect the joint. You also have muscle atrophy, which atrophy meaning the dying off, right? So the muscles atrophy, so it shrinks, right, and it's dying off. And then you have osteonecrosis, right, which the actual bone is now necrotic, is dying, okay? And then I put in purple, as you can see, mainly the blood or vascular system. I try to intertwine those two together. So you see the patient may exhibit signs of anemia, Raynaud's phenomenon, which Raynaud's phenomenon is pretty much, it can happen because of smoking or so, but in this case, of course, it's happening because of lupus. But it's the vasospasm that happens within the vessels, and you'll see the circulation is pale or cyanotic, right? You'll see the fingertips are pale or cyanosis, okay? Temporarily, either because of temperature, whether it's cold or hot, all right? So it's based on the temperature, you're going to see color changes within the actual hands itself, all right? Also, you have serositis, which serositis is inflammation of the serous tissue, all right? And then you also have an increased erythrocyte sedimentation rate, which is also known as ESR, all right? You're also going to see an increase in your C-reactive protein level, okay? Another thing that you're going to see is they're going to have a positive anti-nuclear antibody, which is also known as the ANA test, and you will have lupus erythematosus preparation, all right? And then I put in red, as you can see, is your cardiac problems that you may see with the patient. You have pericarditis, atherosclerosis, you even have pleural effusion, which pleural effusion is dealing with more with the lungs, but remember the lungs and the heart kind of work together, so if something is going on with the lungs, something's going to end up going on with the heart, and vice versa, all right? So that is in red. And then in green, you have changes in behavior, which is your cognitive ability, which now it can also mess up with your neurological system. So as you can see, as we're going through the signs and symptoms, you see how it's a systemic problem. So it's not just only one type of clinical manifestation. There are going to be different kinds just based on what organ it's being attacked. Okay, that's what you're going to see more and more of. I'm just going to continue on with the clinical manifestation because, like I said, there is a lot. So we have our renal damage. Okay, so with our renal damage, one of the biggest indicators is your high blood pressure. Right, all of a sudden, especially if it was controlled before and it's not controlled now. Right, high blood pressure is definitely an indicator of renal damage. Right, or urine output, lack of urine output. So the testing that you want to do, you have your creatinine, your BUN, and you also want to do your urine analysis testing. Test all those things to kind of monitor to see the degree of how the kidney is functioning and is it deteriorating over time. Okay. Another thing is your oral ulcers. Okay, so they are oral ulcers within the oral area. Okay, so the buccal mucosa above the hard palate, right? Also occurs in coughs and associated with acerbation. So every time the signs and symptoms go away, when they come back, they get worse. Okay, so it's not exacerbated. Okay, and then you have alopecia, and with alopecia, it's just pretty much the falling out of your hair, right? And again, key thing here, it goes into remission and exacerbation. All right, so when it comes back, it's coming back even worse. All right, so it's almost like it's coming back with a vengeance. So here we have our diagnostic testing, and with our diagnostic testing, there's not just one particular test that can just pinpoint and say, hey, you have lupus. Okay, I wish there was, but there isn't. But with having different pieces, we can start putting the puzzle together to realize, why is this person sick? Why is this person exhibiting this versus this, and what caused this? You know, so the main thing is a complete history. All right, so your patient is going to be your best indicator of your diagnosis, right? Of lupus. So you want to get a complete history of the patient. You know. And the main thing is your skin changes, okay? As you can see, that's why I put that on the top as far as clinical manifestation, because your skin change is going to be a dead giveaway to let this person know, hey, these are like the common signs of what a person with lupus would have, right? So skin changes is a big thing. You want to ask them, you know, how long have you had the skin changes? Do they come up? Do they go away? You know, is it in the shape of a butterfly when it's gone? Any pigmentation changes? Any dry, scaly rashes that you experience around the neck, around the scalp area, right? Those type of questions to kind of get an understanding of, they're having skin changes, you know, this may be lupus. Also, you have your physical examination. So with your physical examination is your head-to-toe assessment that you do with your patient. Particularly, your dead giveaway, like I said before, is going to be your skin assessment. When you get down to the skin assessment is where you're going to now understand, okay, this patient is exhibiting signs of lupus, right? And then last but not least, your blood test, okay? And within your blood test, mainly your CBC, which is complete blood count, because that's where you're going to find your red blood cells, your white blood cells, your ESR level, which those are going to be elevated, okay? So within that testing, you can see a lot of different things that is going to kind of put that picture together, all right? And then, of course, you can also do your Chem 7 or Chem 12, okay? And that's pretty much your BUN, your creatinine, your potassium, your chloride, your CO2 level, your sodium level, okay? So all those things are going to play a part. Next, we have our medical management, and with our medical management, the main goal of treatment is to pretty much prolong or prevent failure of the organs, okay? That is the main goal, and one of the things that we want to do is we want to monitor and assess how well the treatment is going, right? Is the therapeutic effects working, right? And then also, too, we want to assess the disease activity from day-to-day basis or week-to-week basis or even month-to-month basis. Is there a decline in any of the organ function, okay? So here are some medications. We have our corticosteroids, that is our main category of this medication, that is going to help with a person who has lupus, okay? So you have the topical for a cutaneous manifestation, that is from the skin rashes and so, you would go ahead and use a topical ointment, all right? And then you have your low oral dose for minor disease activity. And then you have your high dose for, of course, your major disease activity. And this is going to be a chronic steroid therapy, all right? And with steroids, right, one of the things you want to inform your patient, especially if she's a female, because a lot of times we are conscious of our weight and how we look in our appearance. So it is going to cause a weight gain, right? So that is something to watch out for. That is something that is expected, okay? Also, thrush in the mouth if the mouth is not rinsed after administration. So a lot of times with corticosteroids, once you take it by mouth, you want to swish some water in your mouth and then you want to spit it out, all right? That is the main thing that you want to at least teach your patient when it comes to corticosteroids. Otherwise, they'll have thrush in their mouth and they'll not only be gaining weight, but then they'll also have thrush, right? And that's like the worst two combinations for a female, right? So next, we have our anti-malarial medication. I know you're probably saying anti-malarial. That sounds for malaria, right? The malaria disease. And yes, it is. But for some reason, they have found that it has some effectiveness to treating lupus. And what the anti-malarial medication is able to do, it's able to also on the cutaneous level as well with those manifestations, but musculoskeletal and then mild systemic features of the SLE, sorry, okay? So those are some properties that the anti-malaria medication have, okay? Also, you have your NSAIDs and your Tylenol, mainly your NSAID, all right, are used for your minor signs and symptoms, and they're also going to be alongside with the corticosteroids because, again, you don't want the patient to be on so much corticosteroids all at once because one, of the weight gain, and two, your body gets dependent on it, and you know your body no longer wants to make its own corticosteroids. So you want to make sure you're tapering here and there, especially if they're taking NSAIDs. So the less corticosteroids that you can use, the better off it is for the patient. Okay, so that's why sometimes you'll see NSAID are working alongside with the corticosteroids. Okay, instead of just only corticosteroids on its own. You also have your immunosuppressive agents, okay? And I wrote here, and it's in blue underlined, some of the medication that you can see, all right? You have pacritinib, alkylating agents, all right? And you also have your analogies, okay? And those are for serious forms of your SLE, okay? So your serious form of your systemic lupus, all right? And then you have your B-cell depleting therapies, and these are some new medications that they have, all right? And this is the newest treatment that that they're using for lupus. And then last but not least, you have your monoclonal antibodies, and these are some medication in that category, all right? And that is going to help with the systemic lupus, okay? Because again, it's an autoimmune disease, and it's pretty much your body is fighting against itself. So you want to suppress the immune system. The whole point is to suppress the immune system so that way your immune system is not fighting against itself. So you decrease your immune system so that way you can save your organs, save your body, all right? That is the main goal of treatment. So remember again, when you have your immune system, their whole thing is inflammation, right? When they get to an area and they're getting ready to fight off, they are going to inflame that area, right? They're secreting different secretions to help fight off. So inflammation is a big deal. So of course, corticosteroids, anti-inflammatory, NSAIDs, anti-inflammatory. So you want to pretty much decrease that immune system response, okay? So you want to decrease the inflammation and you want to decrease your immune system. So kind of think of it like that so that way you can kind of know what drugs to look out for and how they're treating it and why they chose to use those drugs in the first place. That helps to get a better understanding of how to treat it and what to expect. And last, we have our nursing intervention. So what should we do as a nurse with a patient who has lupus, right? So we want to make sure that we're monitoring our skin integrity and we provide frequent oral care, right? Because remember, they have the risk of having the oral ulcers and also the skin condition that they have with the butterfly rash and also with the dry scaly rash as well. Also, you want to make sure that they clean their cells with a mild soap. You want to avoid any perfume soaps or any harsh chemical type of soap because that's just going to irritate the skin more, and the skin is already irritated as it is. So you want to make sure that they avoid those things. Another thing, you also want to assist with the use of ointments or creams to help from the rash, right? So, of course, if they have the topical corticosteroids and they need help putting it in areas where they're not able to reach, as a nurse, you should be able to, and of course, don your gloves and use your proper PPEs to then go ahead and help assist the patient, all right? Also, administration of iron, folic acid, and vitamin supplements for those who are experiencing the anemic effect, okay, because you want to help increase and build that up. Also, high vitamins or a high iron diet or a high protein diet is also recommended. The protein is based on whether or not the kidney function is stable or if it's not stable. So if they have problems with their kidney, then the high protein is probably not going to be the best choice, but definitely recommend the high iron as well as the high vitamin, okay, supplement. Also, you want to help them measure and to conserve energy because remember they do have a history of fatigue. So you want to make sure that they're pacing out their activities and that they're having a balanced rest when they're exercising, okay? So if you see that they're overexerting themselves, let them know it's okay to rest, let them catch their breath, and then go ahead, okay? So they're not easily fatigued. Also, you want to monitor the input and output, okay? And one thing with that, you also want to watch out for their daily weights because they may have fluid overload based on the corticosteroids that they're taking because it does make you gain weight. So you want to make sure that you're checking their daily weights or so when they're in the hospital setting. Also, another thing I put in red, you want to avoid the sunlight. Why? Remember they have that photosensitivity where the sunlight or the actual ultraviolet light, those things are the precipitating factors that's going to cause the signs and symptoms to occur. So if they have to go out, you want to make sure that they have their sunscreen or they have the correct clothing, right? Long sleeve or some sort of thing, or at least a jacket, so that way when they do enter areas where the sun is out, they can put the jacket over, and then when the areas when the sun is gone, they can take it off if they're that type of person who they always get hot all the time, right? Also, you want to monitor proteinuria, which is protein in the urine, as well as red cells cast in the urine, okay? You want to watch out for those things because that's going to let you know how your kidney function is holding up. Another thing you want to watch out for is bruising, bleeding, and your injury, right? Because that lets you know that, hey, maybe this is attacking the red blood cells, right? Or this is attacking the platelets, whatever it is. You want to make sure that, you're monitoring for these things, okay? Also, you have, you want to assist with plasmapheresis, and what plasmapheresis is pretty much the patient, what you're taking away if you're trying to take away those antibodies, all right? Because it's those autoantibodies that is what's causing the whole response to even occur in the first place. So sometimes when you have such a buildup of those autoimmune antibodies, you just want to kind of clear it out. So they'll do a plasmapheresis and they'll go ahead and filter out those antibodies. So of course, if you have less antibodies within your body is less likely going to attack itself just because there is no one there to attack because they have been gone, all right, or they've been removed. So that is a procedure. Of course, all of these things you're just not going to do on your own. Of course, it's by a doctor's order. So you want to make sure that they sign for the consent, you have the paperwork done, and that the doctor is aware and he's already explained the procedure to the patient and what to expect and so on and so forth, okay? Also, you also want to monitor signs of organ involvement such as your pleuritis, your nephritis, your pericarditis, your coronary artery disease, hypertension, neuritis, anemia, right? All these different things. Why? Because you want to know what organ is it affecting, right? Especially these type of organs because most of them are cardiac. So you want to make sure that the major organs are fine, they're safe, and if there is something going on that you want to catch it in the early stages so that way you can prevent further damage from occurring, okay? Because our main goal is to help to preserve the organs because the body will literally destroy each organ or whatever organ it has that marker on one at a time, okay? So you want to make sure you're preserving those organs and you're suppressing that immune system, okay? Next you have, you want to monitor for signs of peritonitis as well, okay? But with the lupus, you have lupus nephritis, and that's pretty much inflammation within the nephrons of the kidneys, okay? And that can occur in the early stages of the disease. So again, that's why it's so important to check on renal function with the labs, and make sure you just monitor day to day the different changes, whether they're subtle or whether they're drastic, and want to implement changes to kind of help prolong the kidney function, all right? And last but not least, with anyone who's going through lupus, you know, you want to give emotional support. You want to provide support groups. You want to give them a chance to verbalize, you know, what they're feeling, their pain, their struggles, especially if it's a female. I'm not saying anything about the guys, but at least for females, you know, we are seen as, you know, carriers for the next generation. And sometimes a woman who wants a child so bad and, you know, is not able to, just because her own system is defeating itself, and just may, you know, start damaging her reproductive organs, because it doesn't select what it wants. It's just attacking the whole entire body. So, you know, for a female with her image, you know, the fact that she has weight gain, the butterfly rash, and you see all these supermodels, and you see all these celebrities, and they have, you know, perfect skin, and all these different things, right, that can kind of eat at you, and, you know, cause your self-esteem to go down, can cause psychological problems as well. You're depressed because you always feel fatigued. You're not able to do normal activities like other people are able to do. So you just want to, you know, provide a listening ear, give them a chance to just kind of vent, and just kind of you know, express how they feel. You know, listening is the best tool that a nurse can do. Sometimes it's not even always talking back and saying something, but just letting you yourself be an outlet for them to kind of release that stress, release that anxiety, that pain, those depression, right? So again, you also want to meet their psychological needs, okay? So be aware of certain things that they may say, how they may look at themselves, you know, provide resources, even a support group that other females or other males can go to and join, and say, hey, you're not alone. You know, these are all these people in this room have lupus, and you can listen to their day-to-day battle of it and how they overcome each and every single day. So again, you just want to provide that support, whether it's female or male. I'm stressing female just because it happens 10 times more in a female than guys, but I'm not excluding you guys. I have all the love for you guys as well, okay? So don't think that I'm only focusing on the female, all right? I know the guys, you know, you guys go through, you know, psychological needs. You know, you feel as if you're less of a man because you're not able to do certain things, or you're not as strong, or you're not able, you know, to be as active or fit as you want to be, right? And all those things can deprive you of, you know, having the best quality of life, all right? So you just want to make sure that you're conscious as a nurse of those things, and provide ways where they can kind of relieve those stress, and just kind of give them exercises where they can help build their self-esteem and build their image and build who they are as a person, okay? So that is pretty much it with lupus. So again, thank you for watching. If you like this video, please give it a thumbs up. If you would like to share it, go ahead and do so. Maybe there's someone that you know who needs information on lupus. Again, if you have any questions or comments, please feel free to leave it in the comment sections below. Also, remember to check out my description box to see all the added information that's not always mentioned on the video. And again, if you have not subscribed, what are you waiting for? Go ahead and click that subscribe button. And thank you for watching and coming on this journey.